Hello. Good evening, friends and loved ones. It's once again a very good privilege, in fact, a great privilege to come to your homes this evening. Yes, in the month of June. Yes, I think the last Sunday in June. Yes, God has been so grateful. Today, the 27th of June. June came slowly but gradually. It's coming to a wonderful end, and I want to thank you all for your continuous um, in tune with us, getting in tune with us every single Sunday. Sometimes Monday in this month. Sometimes we had it on Monday, discussions on Monday, and you've been consistent and you've been so um, in tune with us. Yes, even after discussions, you watch the video on YouTube and then on Facebook. Yes, I want to thank you. I want to use the opportunity to thank you very much for everything. Yes, and everything. We thank God for a wonderful time. So in this month of June, we are marking our 1 year of our Facebook live presentation, and God has been great. God has been so awesome, and He has taken good care of us, and He has given us the spirit of grace, the spirit of wisdom, and so last we talked about a condition called ganglion cyst, and I'm sure we learned a lot. It was mainly around this part of our wrist, around this part. We saw some pictures which depicted what the ganglion cyst is, and the treatments to it, and then the lifestyle modifications to it. But then this wonderful Sunday, the last Sunday of the month of June, we're going to talk about a very interesting topic again, and the topic is titled Baker's Cyst. Baker's Cyst, or as we projected in our flies, that is swelling at the back of behind the knee or at the back of the knee. And so we see some pictures depicting the Baker's Cyst and then what it really entails. So you want to join us to have these wonderful discussions. And we begin this presentation in the name of the Father, and of the Son, and of the Holy Spirit. And you can share the page to your various friends and loved ones to join the discussions. We're very grateful to have others also join. If you have any questions to, yes, all questions are warmly welcome. In fact, we'll be very grateful to have questions and discussions, so it become very fruitful. So before we begin, we will start with a quote by Zig Ziglar. He's one of the prolific quotes, and it says that what you get by achieving your goal is not as important as what you become by achieving your goal. What you get by achieving your goal is not as important as what you become by achieving your goal. So what you get is not so really important, but what you become, your total, your entirety, your whole being, or how transformed you are in achieving your goal, it's very very important than the result of your goal. It keeps you, or it sustains you for higher heights. Okay, so we just zoom into today's presentation. It's titled Baker's Cyst, or Popliteal cyst, or swelling behind the knee. And so you join us in the discussion. So what is Baker's cyst? What is Baker's cyst? So there are so many definitions and descriptions and so many things, but then we'll say a cyst is actually a rounded structure. I'm sure we remember last week's presentation on the ganglion cyst. It's a rounded structure where you have fluid-filled structures, and we have fluid inside the rounded structure, and that structure is a bit thick, and it's not like the normal structure we call a bezier, where we have light structures that surrounds it. But then the cyst is actually a thickened structure which formed at specific joints in the body. So you can have cysts at your elbow, you can have at your fingers, in your finger joints, you can have at your knee, you can have at your ankle. But then specifically this joint, or this joint condition, affects the knee, the back of your knee or behind the knee. That is a specific place. When you have a swelling around the back of your knee or behind your knee, it's most probably the Baker's cyst or the popliteal cyst. And so doctors and physiotherapists go through various assessment procedures to be able to diagnose this condition. Actually, this condition doesn't come just like that, but there are so many causes. So we'll be talking about it. And just around the knee, we have so many structures in the knee. We have the muscles, we have the ligaments, you have the tendons, you have the vessels, blood vessels, we have the arteries, the veins, the meniscus, the capsules, we have the bursa. We have so many structures in the knee, but two main important structures that we'll be considering is the bursa, and then most probably the cyst. Yes, the cyst is actually what comes after or when there is too much of the fluid in the knee region. So what is a bursa? Okay, so what's a bursa? So a bursa is actually a structure, a fluid flow structure that is surrounding the knee. And so it's very important that these structures in every knee, every human being has a bursa in the knee, and this bursa is very important. It helps to prevent friction around the knee joints. So we have the bursa in the knee. So when you are walking, these bursas prevents these structures called the ligaments and the muscles from coming into contact with each other. So the bursa is very important structure to keep the knee in place. In the expense of the bursa, we have other structures called the ligaments, the tendon, the capsules, but they all play their very important role. The bursa is important to prevent friction. So bone to bone interaction, the bursa prevents bone to bone interactions, and then also allows you to move without pain, or probably with minimal pain when the structures in the joints begin to deteriorate. So the bursa is very important. And then in the knee, we'll show you some pictures very soon. We have about 4 different bursas in the knee, or yes, 4 different bursas in the knee, and I will show the points where the bursas are, and this helps to prevent the structures from coming into contact, especially ligaments and then the bones, and it's very important. And other structures also. So the bursas, we have 4 types of bursas in the knee. We have the suprapatellar bursa, we have the infrapatellar bursa, we have the prepatellar bursa, and we have the pes anserine bursa. And these are all very important structures. These bursas are very important to help to prevent friction between structures in the knee. So when these bursas, in the case where there are so many instances where they become excessively inflated or they increase in size, these structures could cause a cyst to be formed. And these cysts, when they are located in the knee, scientists or medical professionals call it Baker's cyst. So that's how actually the mechanism of the Baker's cyst. So we have the inflammation or the swelling around the knee as a result of this structure called the bursa becoming so big. And so we'll be seeing some pictures that indicate this structure or this condition from occurring. And so there are so many treatments for this condition called the bursa or the Baker's cyst. There are so many treatments, but then it's very important that early treatment, all the conditions that we've been talking about in the previous weeks, states or emphatically states that early treatment gives you a very good result. When you wait till it becomes so much unbearable, then you begin to give more work to the medical practitioners in terms of treatment. So early treatment is very important. We have physiotherapy coming into place in the early treatment stage. We have injections to reduce the inflammation, the swelling around the knee joint, and we have icing. We have so many treatments. We'll be talking about it in details very soon. And so actually your knee is one of the most complex structures, if to say not the most complex, but then the most complex structure in the body. Yes, in fact, without your knee, I don't think you can be able to walk. I know some few people have no legs, and yes, they still walk, but a majority, I would say 95% of people living in the world have knees, and so this helps them to walk and to prevent them from falling. And so we have a structure in the knee called the patella, which helps the knee to bend forward and backwards and helps in terms of movement. And we have the bursas also to prevent frictions around this structure called the patella, and so this allows movement and reduces pain. And so you have the bones in the knee, you have the thigh bone, you have the leg bone, you have the patella bone. Yes, so these are one of the, and you have the tibia fibula bone, and these are very important structures or bone structures in the body. And so we talked about the bezier, we talked about the fluid in the knee. You have something we call the synovial fluid, and this actually also is also a tough structure that helps to prevent contact of various structures such as the ligaments and the muscles. And so in the case where the bezier becomes inflated, then we could have something we call the popliteal cyst or the Baker cyst that we are talking about now. So one may ask, we talk about this condition called Baker cyst or popliteal cyst, but then what are the symptoms for this condition called the Baker cyst or the popliteal cyst? Yes, there are certain cardinal signs or symptoms that indicates that someone has a Baker cyst or a popliteal cyst. So one of the signs is the person could have tenderness around the side. So when you put your finger on at the back of the knee, you could feel this rounded structure there that doesn't look so hard and actually not so soft too. So it's semi solid, but then you could feel the roundedness as compared to the other knee. And most cysts don't occur bilaterally, that is on both backs of the knee, but then we could trace some few indicators. I don't think a research has been carried out on where we have the popliteal cyst or the Baker cyst on both knees, but then anything can happen, which we are yet to carry out research probably in Ghana, but outside there are instances where we have bilateral Baker cyst. Okay, so some of the symptoms for this condition is the person could have swelling around the side at the back of the knee. It could have pain. The pain could be minimal, it could be moderate, it could be intense, depending on how the person is able to attribute the pain. So some people can bear pain, some people can also, with the slightest pain, it becomes so exaggerated or becomes so much. So it's relative. The pain is subjective. And the person also could have stiffness or tightness at the knee. That is when the swelling becomes so big. We'll be looking at some pictures indicating the swelling in the knee. So let's all keep listening, and then also we can share the page to the post to other contacts to also keep watching. So what are the causes of Baker cyst or popliteal cyst? Yes, there are so many causes of popliteal cyst, but then one major cause is trauma. So in a case where someone hits the back of your leg, it could injure this structure called the bezier. We'll be looking at the picture soon. And then when it becomes inflamed or swollen, this could result in Baker cyst. That is where we have excessive swelling around the structure called the bezier. It could have also torn cartilage. So where we have overuse. So you do a lot of exercise, and then you exert too much pressure on your knee. These structures could be torn. We have cartilages in between the two bones, the thigh bone and the leg bone. And when these structures get torn, they could result in inflammation of this structure called the bezier, and it could cause a Baker cyst. So we'll be very careful in terms of our activity, not to involve ourselves in too much activity. It doesn't mean that you shouldn't exercise your body, but then in moderation. Okay, so another cause is also the arthritis. So you could have a reduction in the joint space around your knee, and where we have interaction or continuous interaction between the structures of the leg and the thigh bone, they could also result in inflammation or destruction of the structures called the bezier and other structures, and this could lead to Baker cyst or popliteal cyst. And also you could have infection. So you have infection in your knee, and this infection could be transmitted or move into the knee joint. It could be in the thigh, it could be at the leg region, but then when it gets into the knee, it could cause harm and could cause BK cyst. Um, Scientists are still yet to discover some of the major causes of BK cyst, but then they attribute it as unknown. It just comes just like that. And this is one school of thought. Okay, um, so when you have BK cyst, what do you do? What are the complications? What could result in you having BK cyst or swelling at the back of your knee? What is the result? There are so many complications, but then one major factor is when you don't report as early as possible, the swelling can become as larger and as larger as possible, where you will need to take it off through surgery, or yes, it could cause harm to the other structures and the vessels in the body. So it could limit you moving very well. When you're going to sit down, you can't really bend your knee, and it could cause you pain and discomfort, and this pain can make you not perform or not be able to work well if you are young. And so let's take note that when you see any swelling in the back of your knee, report as early as possible to the medical practitioner for you to be seen and treated as early as possible. And then in the case where this swelling bursts and you don't report early, it could cause damage to other structures around the knee, and this could result in so many conditions. If you have clots forming around the bed structures such as the vessels, it could travel and cause so many complications. And so in the case where there's pain around the back of your knee, the pain could be very serious and severe, and you could have also bruising around your ankle, because then you be compensating with your ankle and your hip as a result of the swelling in your knee or the painful knee. Okay, so it's very important that we take note of it. Okay, so we've looked at the description of the condition, the symptoms, the causes, and the complication. But then we look at the diagnosis. So when someone has BK cyst, how do we know as medical practitioners? Yes, so we have so many indicators. We have the X-ray. X-ray really doesn't give you a very vivid description of this condition. So X-ray is not really a first-hand measure. But then you can use the MRI. You can use the CT scan, which is very important also. You can also examine the knee physically. So as physiotherapists, we just look at the back of the knee, and then we use our thumb or any of the fingers, because it's noted that the fingers are very sensitive, so we're able to detect any condition with the fingers. And I'm sure medical doctors also use their fingers a lot to examine patients at any part of the body. Okay, so with the X-ray also, despite you might not see the swelling in the knee, you could see it by what it would be so very visible. But then you could see other conditions such as arthritis. So if you have reduction in joint space, it could influence you having the pain at your knee and the swelling at your knee. So when we take an X-ray, we can also help to further drive to the condition called popliteal cyst. But these are all factors. But then through that, we can be able to arrive at the diagnosis. So we have so many diagnostic tests. We have the ultrasound, which we can see the movement around the knee joints, the other structures such as the capsule, the bursa, which we are more concerned about, the ligaments, yes. And so this gives us also a good presentation of the knee. Okay, so we've talked about the diagnosis. So in every stage where we know what the condition is, then we start treatment as early as possible. So BK cyst is actually as early as possible. It's not so serious a treatment, because then we have exercises, we have treatments, we have medication that help to reduce inflammation and also to improve the activity of daily living of the patient or the person. So at the first instance, the medical doctors will prescribe medications, that is pain relief medications, so that in case there's severe pain, there is reduction in intensity of the pain with medication. Also, The physiotherapist also works in or comes in as part of the multidisciplinary team to be able to reduce pain by other treatment protocols. So we have a procedure called the ice therapy. So we get ice and then place at the back of the knee for some time. So this helps to reduce swelling and improve the movement range around the knee. So after the icing, the patient is able to bend the knee as better as possible. And also we have other exercises. We have stretching exercises. We have the strengthening exercises. We'll be showing some pictures very soon on the type of exercises that every patient is likely to go through when someone has a Baker's cyst or a popliteal cyst, or on the layman's term, a swelling behind the knee joint. Okay, so aside that, we also like to note that in a case where the pain is severe, the swelling is so huge that it can't be remedied by any means, either by medication or by physiotherapy, surgical intervention is taken to place as early as possible. And so surgeons go in to take off the cyst, and then the physiotherapy comes in to maintain the range of motion or the movement around the knee, and then returns to activity. So these are very, very key points. But then you say that yes, I don't have Baker's cyst, yes, I don't have popliteal cyst, yes, but then how can I prevent injury to my knee that could lead to Baker's cyst? Because we mentioned that one of the major cause of Baker's cyst is trauma, that is injury to the knee joints. So how can we prevent injuries to the knee? So it's very important that as athletes, in fact, the underlying point is athletes. Yes, before you start activity, whether you're a footballer, whether you're a golf player, whether you are a basketball player, whether you're a football player, whether you're any sports, rugby, short put, yes, it's very important that you are able to do something we call warm-up exercise and then cool down exercises. So before you start activity, I'm sure the footballers do it a lot, they do warm-up exercises. But as to whether they do cool down exercises, yes, we don't really know. But then a physiotherapist is responsible for leading through these exercises with every patient or every individual who engages in exercises where there's impact or high impact within the exercise or during the exercises. So warm-up exercises and cool-down exercises are very important for any person who is involved in intensive exercise or intensive treatment, or is involved in intensive work. So if your work or your occupation involves intense use of your knee joints or your legs, such as footballers, as basketball players, it's very important that you do something we call a warm-up exercise and the cool-down exercises. It's very, very important. So when you see a physiotherapist, I'm sure he or she will go through with you. If you want to know more about warm-up exercises and cool-down exercises, you can just say hi to the Facebook wall page, and then your reply will be as instant as possible. Okay, so aside that, you also have to wear supportive footwear. And so as we've been saying in a few seconds ago, yes, every sport is very important. So even if you are riding a motorbike, you need to wear knee support, so that in case you fall down, you fall off the motorbike, you don't injure your knee, which could cause inflammation or distraction of this structure called a bursa. And who knows, it could have popliteal cyst. But then you need to get the correct footwear to put on. And also, it's involved that it's actually important that we try to protect our knees, and we wear good footwear. We don't wear so flat foot slippers or flat foot shoes, which will intense or cause increase in pressure at the knee joint. So the more you wear flat shoes or slippers, there's high impact from the foot to the knee directly. But then when you wear quite thick sole shoes and with wedges at the beneath, there is less impact from the heel right into the knee. So then you're able to reduce the likelihood of having the popliteal cyst or Baker's cyst. This is one factor. Okay, so you look at some of the exercises, you look at some of the the lifestyle modifications, we look at the causes, the symptoms of Baker's cyst. But then before we try to summarize all that we talked about, we can look at some pictures to give us a fair idea of all that we're talking about. I'm sure we've talked a lot, like for about 20 minutes, and so we would like to see some pictures so that we understand exactly what we're talking about. Baker's cyst or popliteal cyst or swelling behind the knee. Okay, so just give us a minute as we look at some of the pictures. So I'm sure you understand it after looking at the pictures. Okay, so just give me 1 minute, 1 minute, 1 minute, 1 minute. Okay, so okay, yeah. So sorry. So this is what we're talking about so far. So this is the back of the knee. You can see these structures here. They are all called bases. Bases, yes. So where they are inflamed, they could cause a Baker's cyst or a popliteal cyst or swelling behind the knee. So this is actually the anatomy of the knee. We have the synovial cavity. You can see it here where we have the synovial fluid to prevent communication between this structure, this bone called the femur and the tibia. So we have other structures we call the fat parts also. This helps to cushion the knee joints. You have the meniscus that helps to allow the knee to move forward and backwards and then to rotate inside and outside. And so this is called the. So in the case where the synovial fluid is inflamed, you have the synovial cyst. But that's what we're talking about as today. We're talking about the Baker's cyst. So just around the knee, we have muscles at the knee. We have the gastrocnemius, we have the soleus muscles, and so these are all structures, muscles that helps to allow the knee to move or to move backwards. So you have you bending your knee backwards. So when you ask someone to bend your knee backwards, these structures act in place. You have the gastrocnemius muscles, you have the soleus muscles, and these are major muscles that help to bend your knee. And so you can see this structure here called the popliteal cyst, the same as the Baker's cyst. You can see it here forming. Sometimes, as we mentioned earlier on, we don't know the reason. Sometimes it could be as a result of trauma or high impact to the structure around the side. It could be as a result of infection, and we've mentioned some of the causes in the earlier few seconds ago. Okay, so you can see also, look at it, that's the popliteal cyst or the Baker's cyst. You can see the swelling. This is quite a thicker one, so you can see this is actually a later stage where the patient was able to accommodate the pain and that didn't do anything about it. Okay, so you can see it here, another one here. You can see the swelling here at the back of the knee. So this is called the popliteal cyst or the Baker's cyst. So when you have this experience or you see someone with swelling at the back of the knee, immediately the person should see a physiotherapist or a medical doctor. It's very important. So we have in the case where when it's not treated as early as possible, you can have the back of the knee swelling and becoming very big. So you can see these three legs. You can see how swollen it is. These are all severe stage or later stage of what we call the popliteal cyst or the Baker's cyst. So in this case, the only option is surgery, and so you go through surgery and then to take away some the cyst that has been formed or enlarged. Okay, so this is the Baker's cyst. You can see this here. You can see the swelling around the back of the knee. Yes, so this is also one of the the very intense one. Okay, so this is it. So this is the structure of the knee. We have these are the vessels. We have the popliteal artery. So popliteal artery is actually the vessel that carries oxygenated blood that contains oxygen for you to move and to be able to function and use your leg well. So this is it, and this is called the vein, the popliteal vein. That's what carries the blood away from the knee or the leg back into the heart to get more oxygen. Okay, so this structure is called the popliteal cyst. Yes, you can see the swelling around the side. Yes, okay. So this is also an example of the popliteal cyst or the Baker's cyst. You can see the swelling. So mostly the swelling is at the knee, the back of the knee, close to the left side, the left side of the knee. You can see it's around the side, the left side of the knee. So the cyst is mostly found here. You can see the previous slide. You can see it's around this side. Okay. Yes. So these are all pictures indicating this. So this is it. So you can see some of the surgical interventions or the medical interventions or the physiotherapy interventions to it. So you can see this is called the ultrasound. The ultrasound. So as physiotherapists, we go through ultrasound therapy, and this helps to be able to reduce the swelling and then improve the movement around the knee. You can see this is also an injection to reduce the swelling and to take up the fluid into circulation. So this is the ultrasound picture showing you how the knee joints looks like. Okay. So this also the picture showing the biggest cyst at the back of the knee. This okay, see the medium size and this is the large size. You can see this is very big. If you look at it here, very big. But this is actually moderately big. Okay. So this is also a picture here. So another one here, another one here, another one here. Okay. Yes, so you can see a very good indication to it. So as physiotherapists also we have a treatment protocol we call the kinesio taping. So this actually looks like a tape which will roll around the back of the knee and it helps to take away pain and also to reduce swelling at the knee joints. So you can see the physiotherapist holding the tape and has applied one at the back of the knee or behind the knee, and it's about to apply the second one. So it's very important. So as physiotherapists, we teach exercises such as using this structure is called the theraband, and then stretching exercises by the patient. So the patient is stretching the knee, the back of the knee, and this helps to reduce swelling and improve upon the function. Okay, so we have exercises such as this, so the patient can go through these exercises, and then this helps to stretch the knee and reduce swelling and pain. So another form of exercise that the patient can do. So these are all exercises that as physiotherapists we teach patients with this condition, and this is called the ice therapy. So this is the cold compressed around the knee to reduce the pain. Okay, another exercise. So these are all exercises that as a patient has popliteal cyst or Baker's cyst goes through. Okay, this is anatomy of the knee. Okay, this is a Baker's cyst. Okay, so this actually the anatomy of the knee from looking from top. Okay, so this actually I was talking about the bezels in the patella. We have the pes and serin bezel, they have the infrapatellar bezel, we have the prepatellar bezel and the suprapatellar bezel. These are all important to keep the knee in shape and to prevent friction in the knee. This is anatomy of the knee. Okay, so I'm sure we are cool with the pictures, and so we continue with our final lap. Okay, all right, I'm sure we've learned a lot from this discussion. Myself I have learned a lot. Yes, I've learned a lot, and I'm sure we'll be in a very good position to teach so many people about this condition called the Baker's cyst or the popliteal cyst or the swelling behind the knee. And so thank you very much for your time. Yes, we've taken about 30 minutes to discuss this condition. I'm sure it has been extensive, and so we can share the page for others also to learn from. So without much ado, we thank you for being part of this discussion. And so our next topic for discussion is actually also an interesting topic. I'm sure it was rolled out to the 4 continuous topics that we'll be talking about within these 4 weeks. And so the first one we've talked about, we have the ganglion cyst and the swelling at the knee, at the wrist, and then the second one we talked about the Baker's cyst today. We've talked about it today, and then the other one is called asthma. Yes, it's actually a condition that we will discuss next week. And so I'm sure we've seen the topics for the 4 consecutive weeks. And so next week by this time we're discussing this condition, and so we'll talk about extensively. And then the fourth topic is actually undercover. I'm sure some of you have seen on Facebook. So if you want to see the fourth topic, you can just join the Facebook post, and then you can scroll down where you see the next topic. So without much we do, okay, so some people are interested in getting to know the last topic, the fourth topic. So it's also an interesting topic. Yes. So okay, I'll keep it as a secret. So next week we'll tell you about next topic. So have a blessed evening. May the good Lord be with us all. Have a wonderful week and take care. Bye bye.